Buongiorno a tutti, ben collegati. Siamo oggi per il secondo giorno dedicato alle partnership. Siamo qui per presentare un'altra partnership, la Innovative Health Initiative. Siamo qui con ben 5 relatori, 2 provenienti dall'Innovative Health Initiative, ve li presenterò poi nel corso della giornata, 2 rappresentanti delle associazioni industriali che fanno parte della JU. Abbiamo ovviamente, in indirizzo di saluto, il dottor Michele Mazzola del Ministero Università e Ricerca, che è responsabile dell'ufficio terzo, proprio che ha, la responsabilità, oltre a di Horizon Europe in genere, anche di tutte le partnership, legate al programma. Abbiamo con noi anche il professor Eugenio Guglielmelli, che è il rappresentante per il cluster 1 di Horizon Europe. Anche lì abbiamo ovviamente una responsabilità che esula dal solo cluster 1, ma che copre poi tutte le partnership, 9 partnership che legate all'area health, come pure la mission cancer, e il direttore di APRE, l'ingegner Marco Falsetti, che appunto parteciperà agli indirizzi di saluto raccontando anche quello che APRE ha fatto, sta facendo, in relazione alle partnership. Lascerei appunto subito, la parola per gli indirizzi di saluto al dottor Michele Mazzola dal Ministero Università e Ricerca. Grazie.
A tutti, per prima cosa un saluto doveroso anche a nome del direttore generale, il dottor Consoli, a tutti i partecipanti, a tutta la comunità scientifica che ci sta seguendo e ovviamente un ringraziamento ad APRE che in questi 2 giorni ha messo in piedi 2 iniziative veramente importanti e centrali sulle priorità che stiamo seguendo. In particolare oggi si tratterà della partnership Innovative Health Initiative. Solo alcune brevi indicazioni, più che indicazioni diciamo alcune brevi sottolineature che preme fare il lato Ministero. È molto importante in questo momento che la comunità scientifica, con il supporto ovviamente di APRE, con il supporto del Ministero, abbia un ruolo importante all'interno delle partnership europee. Questo perché questo strumento costituisce sicuramente un bacino economico da tenere presente, e su questo poi tornerò velocemente, ma anche un bacino di competenze che è fondamentale per tutto il sistema della ricerca nazionale e soprattutto per porre questo sistema in un contesto europeo e internazionale in senso più ampio del termine. Quindi su questo l'invito ovviamente del Ministero alla comunità è di essere il più possibile, ovviamente in base alle proprie forze, partecipe all'interno di questo percorso. Lato economico preme anche sottolineare perché tutti voi, suppongo, come noi, in questi mesi siamo e saremo sostanzialmente dedicati alla gestione dei progetti del PNRR, che hanno determinato un investimento forte nel mondo della ricerca in questa fase, però teniamo presente che è un investimento di molti milioni di euro, ma temporalmente molto delimitato, perché come sapete, soprattutto chi ha progetti ad esempio sui bandi che ho gestito io, ma anche chi sta gestendo il collega Cobis, queste risorse hanno una scadenza molto precisa. Questa sottolineatura perché? Per dire che è importante, per quanto si stia lavorando sul PNRR, mantenere gli occhi sulle fonti di finanziamento internazionali in modo da non perdere questa linea di contatto e continuare ad avere un ruolo attrattivo anche di risorse per il mondo scientifico a livello nazionale. Questa è una sottolineatura che ritenevo importante fare proprio perché siamo consapevoli che vi stiamo chiedendo anche uno sforzo doppio, diciamo, continuativo sul lato europeo e internazionale per partecipare a queste iniziative e aggiuntivo su l'unicum che è il PNRR in questo momento. Però è importante in questa fase mantenere insieme 2 piani in modo che il PNRR possa diventare un elemento, un punto di partenza, un punto attraverso cui noi andiamo ad esempio a rafforzare ancora di più le nostre infrastrutture o la nostra capacità di fare ricerca proprio in una prospettiva di ampliare l'orizzonte europeo e internazionale. Oggi è dedicata all'Innovative Health Initiative, molto importante, anche qui una scadenza ravvicinata al 20 settembre, quindi non vi rubo altro tempo, ringrazio tutti i relatori che si alterneranno oggi per il contributo sicuramente essenziale che daranno al lavoro di tutti noi. Grazie a tutti.
Grazie dottor Mazzola. Effettivamente il periodo è molto intenso e quest'estate effettivamente sarà molto piena, da tanti punti di vista di scadenze, sia sul cluster 1 che le partnership. Comunque, i nostri ricercatori, sicuramente metteranno tutto l'impegno possibile per raggiungere sicuramente mete, migliori rispetto a quelle dello scorso programma, che abbiamo registrato proprio durante, la diciamo vecchia partnership, IMI 2. E a questo proposito mi collego, con il, successivo relatore per i saluti, di indirizzo, che è appunto il rappresentante, il professor Eugenio Guglielmelli, che partecipa appunto dall'inizio di Horizon Europe proprio al comitato di programma dedicato al cluster health, e quindi seguirà tutte le questioni anche legate alle partnership dell'area health e le evoluzioni della partecipazione italiana anche alla nuova partnership IHI. Professor Guglielmelli, a lei la parola.
Grazie mille, buongiorno a tutti, grazie per l'invito e per l'organizzazione di questo importante evento, di questa sequenza di eventi molto rilevanti per stimolare la nostra comunità a essere sempre più protagonista e in prima linea. Su questo apre un attore fondamentale nel paese, nella rete europea. Ringrazio in particolare Caterina Bonocore come referente National Contact Point proprio per la parte sui temi della salute. E un'iniziativa, questa partnership, assolutamente strategica per consolidare sempre di più le sinergie col mondo industriale, come storicamente già nelle precedenti esperienze delle iniziative IMI, che ora sono diventati IHI, ma che ovviamente hanno sempre la I iniziale sull'innovazione come priorità massima, un'innovazione che non può essere un veicolo di soluzioni concrete se non c'è un coinvolgimento delle aziende, sia i big player, ma anche e soprattutto le piccole e medie imprese, le start-up innovative che possono essere quelle più creative, più disponibili a un'innovazione radicale, che a volte può essere anche dirompente, come abbiamo sperimentato anche in questo periodo pandemico di emergenze, che ha fatto capire come ridurre il gap tra il bench side e il bedside può anche diventare una sfida per gestire situazioni emergenziali in meno di un anno con la proposta di nuove terapie, nuovi farmaci. Ovviamente è un'innovazione che guarda a tutta la medicina moderna, non solo sugli aspetti di diagnostica precoce, diagnostica avanzata, terapie innovative e tutte le filiere di cure di continuità per gestire le patologie che hanno poi cronicità, a partire da quelle più rilevanti, oncologiche, cardiologiche, neurodegenerative, che sono proprio oggetto dei topic in scadenza per il bando a settembre, sia come single stage che come two stage. E l'obiettivo strategico di IHI è proprio quello di contribuire anche a queste missioni strategiche, obiettivi prioritari, sia sulla parte in particolare beating cancer che su tutti gli aspetti di innovazione industriale. E ci sono opportunità, come vedrete poi in dettaglio, anche proprio per gli early feasibility studies dell'innovazione, dove le industrie devono essere ancora di più in prima linea e dimostrare una feasibility, che vuol dire soluzioni che partono da approcci di sicurezza avanzata, che l'uso avanzato anche delle tecnologie abilitanti per tutte queste soluzioni innovative non può essere marginale, devono essere sempre centrate sulla persona, che vuol dire il paziente, ma anche tutti gli operatori sanitari, fino a tutti gli ambienti sociali, le famiglie coinvolte soprattutto negli aspetti di continuità delle cure, e devono avere ovviamente un'efficacia e una costo-efficacia sempre più rilevante. Quindi cose che nei progetti devono essere chiare, devono essere nelle prime 10 righe, ben esplicitate come obiettivi di ogni singolo progetto, condivisi tra il mondo della ricerca pronto per l'aspetto traslazionale e la componente industriale più rilevante, più sensibile alla tematica del progetto. E questi aspetti ovviamente devono vedere anche un forte coinvolgimento della rete ospedaliera più sensibile anche alla ricerca, a partire da tutto il mondo degli istituti di ricovero e cura a carattere scientifico, dai policlinici universitari, tutti coloro che hanno una comunità clinica disponibile a investire il loro tempo anche su aspetti di ricerca avanzata traslazionale. Come ricordava Caterina, mi piace chiudere questa breve introduzione ricordando anche quali sono stati, ringrazio l'APRE per aver condiviso dei dati oggettivi pubblicati a marzo 2022, sulla performance italiana nelle precedenti call dell'iniziativa EMI2, quindi l'ultima parte di Horizon Europe concentrata su questo ramo di innovazione industriale, che vede l'Italia ancora non in primissima linea, perché siamo sesti in termini di livelli di partecipazione ai progetti, 138 progetti come partner rispetto al numero 1 UK, 442 progetti come partner e di fatto un contributo poi in termini di finanziamenti che è leggermente ancora più indietro come ranking al 7° posto, ma di fatto molto meno rilevante, 60 milioni di euro rispetto ai 275 milioni di euro di UK, con un ruolo molto avanzato di paesi non solo della stessa massa critica dell'Italia, come la Germania, la Francia, la Spagna, ma anche Belgio, Olanda, che possono essere sicuramente riferimenti di buone pratiche, di capire come essere sempre più in prima linea, fare massa critica, avere anche un ruolo sempre più rilevante sul coordinamento che attualmente è solo sul 12,5% con un 30% di success rate, quindi success rate rilevante, ma dove dobbiamo essere più in prima linea. Quindi sicuramente sono molto confidente che anche questo tipo di eventi, ma poi il sostegno, il supporto, l'attenzione che APRE può dare a seguire in rete anche con tutti i grant office nazionali degli enti, delle aziende coinvolte nelle proposte, anche per ampliare le reti europee nel modo giusto, può essere di forte rilevanza e do massima disponibilità sia personalmente come referente, che ho il piacere di svolgere questo ruolo per incarico del Ministero dell'Università e della Ricerca, del Cluster Health, e insieme al gruppo di lavoro italiano, Monica Di Luca, che è molto in prima linea anche sul PNRR Neuroscienze, Maria Grazia Pizza, Stefano Vella, Sabrina Montante, Ariela Benigni, anche persone quindi che hanno molta sensibilità sia col mondo IRCS, col mondo industriale e con la rete europea, le presenze dirette a Bruxelles, che sono a piena disposizione di tutti coloro che possono avere un bisogno diretto di supporto, di consigli, di raccomandazione, al netto ovviamente di cose riservate sulle programmazioni future che non possiamo ancora divulgare. Quindi buon lavoro, buona giornata per questo evento importantissimo. Grazie a tutti.
Grazie professor Guglielmelli, grazie per aver fatto questo recap un po' di tutto quello che sta accadendo anche all'interno della compagine Cluster 1, il comitato che lei presiede. E sì, anche da parte nostra, insomma, ci impegniamo a sviluppare nei prossimi mesi delle attività che possano, come ha detto, consolidare le sinergie col mondo industriale, perché effettivamente questo è stato un nodo molto importante e probabilmente critico, proprio nella scorsa programmazione di IMI 1 e IMI 2. Auguro anche a lei buon lavoro, buon proseguimento. So che anche lei deve, scollegarsi tra poco, quindi grazie ancora per questa intro e a presto. E chiudiamo allora, diciamo la carrellata di, saluti introduttivi e di prime considerazioni da un punto di vista, nazionale, sulla partnership IHI con, anche un commento da parte del direttore di APRE, l'ingegner Marco Falsetti.
Allora, buongiorno, spero che mi sentiate bene e buongiorno a tutti, buongiorno soprattutto a chi ci sta ascoltando da fuori, ma soprattutto anche un saluto a tutti coloro che parteciperanno e daranno corpo a questa giornata, quindi un ringraziamento non solo al MUR e al professor Guglielmelli, ma soprattutto agli speaker che da questa in particolare partnerships oggi arricchiranno un po' il discorso. Allora, come è già stato detto, lo ha detto Caterina all'inizio, questa è una 2 giorni che è iniziata ieri, organizzata da Apri, chiaramente organizza Apri, ma queste cose si fanno per portare evidentemente un messaggio che è quello del Ministero, che è una serie di eventi che hanno come fondamentalmente obiettivo contribuire alla diffusione di quello che sono delle opportunità e delle dinamiche che accadono a livello di Horizon Europe. Quindi evidentemente, come al solito, questo è un evento che vede in primis l'imprimatur del Ministero. Noi siamo un po' la parte operativa di tutto questo, però ci fa piacere essere parte operativa di questo discorso perché ci crediamo molto. Ieri abbiamo cominciato per esempio parlando su un altro partenariato legato alla bioeconomy. Oggi parliamo del partenariato IHI, che è sostanzialmente l'evoluzione di IMI, come è stato ricordato poc'anzi. Cosa aggiungere a quello che è stato detto? Beh, non voglio entrare nel merito di questo partenariato, ripeto, ci sono un sacco di persone che oggi vi daranno informazioni molto interessanti e puntuali, ma soprattutto molto più interessanti di quello che potrei darvi io. Vorrei ricondividere un po' la stessa osservazione che ho condiviso ieri in un altro contesto, ma sempre sui partenariati. E mi riallaccio a quello che ha appena detto il professor Guglielmelli, quando ha ricordato un po' anche quali sono state le nostre performance diciamo passate e quelle che sono state anche l'inizio di Horizon nel nuovo, in questo caso i dati erano riferiti a salute. Perché ci dobbiamo ricordare sempre una cosa, ci sono due fatti. Al di là di quella che è la partecipazione che oggi il sistema italiano nei vari settori riesce a raggiungere, e in taluni settori è anche una partecipazione buona, in particolare su salute non è malvagia, ma è sicuramente migliorabile. Ma in generale i margini di migliorabilità su salute e su tante altre cose sono ancora importanti. E lo dico perché mi capita quotidianamente che quando poi ci si confronta con le persone ci si accorge che alcune cose che sembrano abbastanza semplici per chi come noi fa ogni giorno questo lavoro poi non sono così semplici. Anche sui partenariati bisogna continuare a raccontare una storia. Non è vero che è tutto chiaro a chi sta dall'altra parte. Certo, ci sono moltissime realtà che sono talmente ormai avanzate nella concezione, perché sono presenti in certe dinamiche, che non c'è bisogno di aggiungere molto. Ma come Apri abbiamo ancora la necessità di aumentare la platea di persone che conoscano bene tutto questo. E a questo proposito, e vado in conclusione perché il tempo è solamente poco in questo caso, io vorrei ricordarvi una cosa. Chi di voi che è sicuramente attivo nel mondo salute sa che la Commissione ha apparecchiato la tavola delle opportunità di tante cose. È apparecchiato addirittura nel campo salute, ci sono 3 grandi famiglie di possibilità. Uno è la ricerca collaborativa, quella che trovate all'interno del World Program di Cluster 1, tanto per capirsi. C'è la mission Cancer, che è ancora nei primi vagiti, ma che comunque ormai è già partita ed è entrata nella sua fase implementativa. E c'è anche, per esempio, questo partenariato. Allora, quello che vorrei fare è far capire che è chiaro che queste sono tutte e 3 possibilità, e quindi è bene che voi guardiate l'insieme di tutto quello che c'è sul tavolo. Però non dimenticate anche di guardare agli strumenti nelle diverse maniere. E qui torno al discorso del partenariato. Che cosa c'è da capire sui partenariati rispetto per esempio alla ricerca collaborativa? Fondamentalmente una cosa sola. L'ho semplificato adesso, ma insomma. è che certo il partenariato è una opportunità di partecipare, perché anche il partenariato poi ha delle call, e quindi io sono un ricercatore, vedo una call, mi interessa, vedo un topic in particolare e applico. Perfetto, questo è corretto. Ma che differenza c'è tra una topic di partenariato e una topic di cluster 1? Beh, c'è intanto un po' di coerenza tra tutto quanto. L'invito è, e qui noi ci siamo, se vogliamo anche confrontarci o vogliamo in qualche modo tentare di passare questo messaggio, che il partenariato va capito nella sua interezza, che è diversa rispetto a quella che è la lettura di un Work Program di Cluster 1. Nel partenariato, il concetto di partenariato stesso pone una dinamica che va capita perché va giocata. Allora l'invito è questo: certamente guardiamo al partenariato in un'ottica, come dire, light. Ci sono delle opportunità, ci sono delle call, guardo quelle call e magari se c'è qualche topic che mi interessa ci partecipo. Ma non dimenticate che per essere attori di un partenariato significa anche essere parte della dinamica del partenariato, e quindi invito è, soprattutto in particolare in questo caso a un certo tipo di sistema, anche compreso quello industriale, a diventare attori del partenariato, perché la differenziazione tra un cluster 1 e un partenariato è che nel partenariato la Commissione ha costruito una scatola nella quale si può essere anche un po' attori. Quindi ben venga l'attenzione su quelle che sono le call che questo partenariato mette a disposizione, perché questa è una lettura comunque benvenuta, ma cerchiamo di capire, e su questo cercheremo anche noi di fare il massimo, e comunque il confronto con Apre su questo è continuo qualora veniate a chiederci un po' di chiarimenti. Siate anche lì attori, cioè i partenariati non si esauriscono alla lettura delle potenzialità delle call, ma l'obiettivo è quello di diventare parte di quel meccanismo, perché diventando parte di quel meccanismo se ne diventa non solo interpreti, ma se ne diventa anche registi di quello che il partenariato farà oggi e domani. Io mi fermo qua, vi faccio un grande in bocca al lupo per la giornata, ringrazio ancora tutti i partecipanti, ringrazio evidentemente lo staff di Apre come sempre, perché poi alla fine queste cose si fanno grazie alla loro dedizione, e buona giornata.
Grazie Ingegner Falsetti, grazie Marco per aver anche inserito insomma dei nuovi elementi, delle nuove considerazioni di spunto per chi parteciperà e deciderà di partecipare alle call della nuova partnership IHI. In questo momento vorrei effettivamente passare all'inglese. I will switch to English because this session will be mainly composed by international speakers. I will introduce them one by one. I would like to call as first on stage Mr. Polyvius Ajangu from IHIJU. I also want to say that there was a modification on the program because we also have connected Mr. Hugh Laverty, which I want to thank very, very much. And I also want to thank Mr. Polyvius Ajango because today in Belgium is a holiday. And actually, our invitation was a bit complex to manage, but they were so nice to accept our invitation anyway. So we will have today on stage Mr. Polyvius Ajangu, but we also have in the backstage Mr. Laverty, who had a health problem, so we fixed with a substitute. But he is also there listening and available for answering to questions that might come from you, from the audience. And to this extent, I want to remember that as yesterday, we will collect questions using Slido. So as always, if you go on the website sli.do, you see it going on the screen with the code EP22. You can pose questions to our for now, our first speaker. You can do it in English, you can do it in Italian, as you feel. So, okay, thank you. Now the floor is yours, Polybius. Thank you for joining.
Grazie Caterina, buongiorno a tutti. Purtroppo non parlo italiano, so like Caterina said, we will do the presentation in English. I'm Polybius Hajiyangu. I'm the Scientific Operations Coordinator at IHI. And today we'll talk a bit on the IHI and give you more information about the future course. Okay, so today we'll touch upon the need why we have needed to create the IHI. We'll talk about the governance, our strategic research and innovation agenda, our objectives, how to apply for funding. We'll go through briefly on the topics of the first calls, how to get involved, and how to keep you up to date. IHI has been created last year, December last year, through the Single Basic Act, the European legislation, together with the other European joint undertakings. But why we needed IHI? First of all, there are huge challenges to address as a society, and this requires to mobilize the public and the private sector. And COVID-19 actually shows this need that without bringing the public and the private sector, we wouldn't be able to immediately address this public health emergency. Of course, the healthcare ecosystems are quite complex. Europe should work towards the modernization of these healthcare systems, and also to bring innovation that is accessible and affordable to EU citizens. Increasing burden of disease for patients and also the cost for the healthcare delivery are also challenges that push for the creation of IHI. But IHI is not an idea, it wasn't a need that actually just generated now. It was already from IMI2, where the pool of experts, the experts panel performing the interim evaluation of the program, stressed the need for engagement of the industry sectors with the pharmaceutical industry, so to capitalize their expertise in the development of the new healthcare intervention. But IHI builds on the 14 years of IMI, but it strives to be more inclusive. We integrate sectors well beyond the pharmaceutical industries, including diagnostics, medical imaging, medical devices, and of course, everything digital. And why is that? This is necessary to both accelerate innovation for the benefits of the EU citizens, of course, but also to help maintain the industrial competitiveness of the European healthcare industry sector. Therefore, this new partnership has a broader scope, a wider range of stakeholders, working towards a better prevention, diagnostics, and treatment by integrating various technologies coming from the pharmaceutical, medtech, biotech, imaging, and vaccines. With this new partnership, we have better responding to the public health needs, better addressing the requirements of patients and healthcare professionals, and of course, we're more open to new ideas by integrating all the relevant stakeholders. Of course, the notion of the cross-sectoriality, the cross-sectoral collaboration is at the heart of the new public-private partnership. But this PPP needs to work together, and things need to change. And first, one of the biggest obstacles is to break the silos across the different industries. the need of change in terms of the translation of the science. All this research we develop at the European level to bring them to the European citizens. The new partnership, the cross-sectoral partnership, should work together with the aim to break these silos through their activities, to bring new capabilities and standards to diagnostics and biotech, and of course, support the translation of scientific and tech advances while harnessing big data to improve health. So, what about IHI? IHI is a collaboration between the European Union and more broader range of industry sectors. We bring the biopharmaceutical, biotechnology, digital health, and medical technology sectors, but working together and closely with the academics, patients, regulators, and other healthcare professionals. We might build on this 14 years experience of IMI. We have over 200 projects that utilize the results, but the focus and the goal of the new program is to build on an interdisciplinary, sustainable, patient-centric health research partnership to help transform the patients' lives. We have our founding members from the private sector, the industrial members coming from the associations of COSIR, FPA, Eurobio, Medtech Europe, and Vaccines Europe. And from the public side, we have the European Union represented by the European Commission. In IHI, we have, of course, now a new program, and we have a new governance structure that we'll touch upon it later. Here, we now cover the full value chain, the full entire consortium of care. We have a new set of objectives based on the strategic research and innovation agenda, which are actually aligned with the EU health policy strategies. IHI is the implementing body. We actually launch calls for proposals, open calls for proposals, and competitive single and two-stage calls, where we mobilize this funding by our members in order to fund projects that will manage through the full life cycle. Regarding our budget, IHI needs to mobilize lots of funding coming from the European Union, 1.2 billion euro from the health clusters of Horizon Europe. And these will match with at least 1 billion provided by the industry associations and 200 million from contributing partners. IHI program and also our project is expected to deliver tangible impact and results in order to meet the objectives of the SRIA, the Strategic Research Innovation Agenda. However, our projects and our program, importantly, should contribute to other EU policies. Of course, the Horizon Europe, which we are part of it. It is also expected to contribute to Europe's Beating Cancer Plan, the new industrial strategy for Europe, the pharmaceutical strategy for Europe, and the European health data space. IHI is also aligned with the United Nations Sustainable Development Goal, the number 3, ensuring healthy lives and promoting well-being for all ages. IHI, as previously mentioned, we might build on this experience from IMI 1 and IMI 2, but this is not a direct continuation of IMI. We have already existing platforms, we have the project results that we have to also broaden the scope by bringing new partners and wider stakeholder base. And of course, we don't work in isolation. IHI seeks synergies with other Horizon Europe activities, other European partnerships at EU and national level. Regarding our governance, every public-private partnership, every organization is governed by certain bodies. In our case, we have the governing board, where the founding members sitting together. From one side, we have the European Union represented by the European Commission, and of course, we have our industrial members, CONSIR, Europa Bio, FPI, including Vaccines Europe, and Medtech. Here now we have also the advisory bodies, the State Representative Group, and the Science and Innovation Panel, which is a novelty for IHI, the Science Innovation Panel, where both advisory bodies give feedback to the governing board and, of course, the program office. Overall, the governing board oversees the work and gives direction to the program office through the executive director. And IHI is actually the implementing body of the program. I think it's very important also to highlight the role of the Science and Innovation Panel, because this is a novelty and it's how we show that all the stakeholders of the healthcare is included in our program. The SIP is providing science-based advice to the governing board on the draft of our programs. We actually consult with this advisory body before publishing the course, the topic text. Consultations is also taking place in case we need to update the SRIA. Of course, the planning of the additional activities. In case we need to focus on specific scientific priorities, they may have a setup of advisory groups, and SIP is playing a vital role on this aspect. And of course, it's helping and advising on synergies with other Horizon Europe activities, other European partnerships at European and national level. The SIP composition, we have, of course, participation from our founding members, coming from the European Commission and also from the industries. The State Representative Group is also part of SIP through members. And of course, it's importantly to have the representation of the scientific community and also to have stakeholders involved in the full consortium care, patients, healthcare professionals, healthcare providers, regulatory bodies, health technology assessment bodies, etc. Here you can see now the composition of the SIP permanent members from the scientific community, our founding members, the representative group, and also from the stakeholders with the healthcare providers, regulators, healthcare professionals, patients, and HTA bodies. So we actually achieve through the beginning of the establishment of the SIP the coverage of the, let's say, of the full value chain of the healthcare system. Now we'll touch upon the strategic research and innovation agenda, which is actually our Bible. This agenda is governed also our activities. In high level, the SRIA focuses on the cross-sectoral approaches, so to facilitate the creation of new products and services, so to prevent, intercept, diagnose, treat, and manage diseases and foster recovery more efficiently. The goal is to lay foundations for development of safer and more effective health care products to respond to unmet public health needs We actually need solutions, ideas, and products that actually can be implemented into healthcare systems. Very broadly, we have a set of general objectives. Our objectives is set out in the legislation, in the Single Basic Act creating IHI. And our general objective is to turn health research and innovation into real benefits for patients and society. We're looking to deliver safe, effective health innovations that cover the entire spectrum of care, from prevention to diagnosis and treatment, particular, as I mentioned several times, in the areas where there is unmet public health need. And of course, to work closely with health industries, support the health industries that can make them globally competitive. Regarding our specific objectives, the IHI program, our projects should generate results and impact in order to meet these specific objectives. First of all, to improve our understandings of the factors that affect our health and the development of treatment of certain diseases. We're looking to integrate this fragmented health research and innovation efforts in areas of unmet public health needs, of course, by bringing together the health industry sectors and other stakeholders. And this will actually enable us to create tools, data, platforms, technologies, and processes that will facilitate the prevention, diagnosis, treatment, and management of the diseases. Importantly, is also to demonstrate the feasibility of integrated healthcare solutions by bringing the various technologies from the different sectors already mentioned in the beginning of the presentation. So to address the needs of the people that we will use them, and is actually more focused on the patients and the healthcare professionals. Of course, to make a better use of the opportunities to gather the health data and use it in research and care, and of course, respecting privacy. And finally, to develop ways of assessing the value of innovative integrated healthcare solutions for patients and carers, healthcare professionals and organizations, and other stakeholders. Now we're moving to call evaluation and planning. In IHI, like I mentioned in the beginning of the presentation, we bring forward a range of single and two-stage topics. So we implement single and two-stage call for proposals. In IHI, we envisage to have more single-stage topics, which is a more bottom-up and are more flexible in terms of the application, creation, and submission. Here you can see now the schematic for the single-stage procedure, starting now from the topic definition, while the IHI is the pen holder of the topic. We are the ones, the program office, that is responsible for the topic development. However, we're not drafting them by ourselves. We seek input from the wider research communities. Of course, we consult our industrial partners and also the European Commission, other stakeholders in the health community, and of course, the science and innovation panel. As soon as we have a stable topic text, we launch formally the consultation with our advisory bodies, and we seek advice from them on the topic text. And as soon as we have the final version, we launch the governing board in order to approve and then launch the call for proposals. In the single stage procedure, it comes that all applicants should work together in a single consortium and prepare a full proposals, meaning that in the consortium, we need to have the public and the private partners from the beginning together. Public and private in terms of academics, hospitals, regulators, patient organizations, small and medium enterprises, large companies, etc., etc. Novelty for IHI is a 45% eligibility criterion that we'll also touch upon it later. Applicants should ensure that the 45% of the total budget should come by the industry members through the form of in-kind contributions. Without the 45%, the proposals will not be eligible, therefore will not be evaluated. It's essential to highlight once again that this 45%, it has to come by the members. If other type of participants would like to provide in-kind contribution, but they are not members of the industry associations, this amount will not be taken into account while calculating the 45%. Then, as soon as we have the submission deadline, the evaluation will come, and this is a normal evaluation process similar to the H2020. Independent experts will evaluate the proposals, where they will be scored and ranked, and based on the available funding, the Ihi Program Office will invite the top-ranked proposals in the granting phase. During this grant preparation, we'll have a part of preparation for the signature of the grant agreement. But before any signature, we need to ensure that the consortium will have and conclude and sign the consortium agreement. And afterwards, everything should go smooth for the launch of the product. Similar schematic now we have for the two-stage procedure. However, we have some important differences. With regards to the topic definition, here the pen holder is actually our industrial partners. And why? Because they should identify from the beginning their in-kind contribution. Once again, when we have a stable draft topic text, we'll go through the consultation, formal consultation with the advisory bodies, the SRG and the SIP. Then we'll have the governing board approval, and we will launch the call for proposals. And now it comes to the first stage out of the two stage. In the first stage, we'll have the applicant consortium. The consortium actually that will prepare a short proposal in order to address the specific challenges of the specific topic. This applicant consortium can consist members from the academia, hospitals, regulators, patient organizations, SMEs, and for-profit legal entities. Once again, we'll go through the normal evaluation process. Independent experts will assess the proposals, where we'll have scored and ranked. Importantly to mention that only one proposal will go to the second stage. And why only one? Is because during the second stage, the pre-identified industry consortium, the one actually that drafted the topic, will merge with this top-ranked proposal consortium. Then they will prepare a full proposal, and eventually, if everything goes smoothly, we'll run once again the evaluation, and if successful, Ihi Program Office will invite the full consortium in the granting phase. Once again, a signature, a consortium agreement signature is required before the grant agreement signature by Ihi. Moving now to the eligibility rules, starting with the participation, which is actually aligned with the Horizon Europe. Who is eligible to participate? I would say simply everyone. Ihi is open to the world, so any legal entity or international organization, regardless of its place of establishment, could actually participate in Ihi. However, this consortium should include at least 3 independent legal entities from different member states or associate countries. Novelty for Horizon Europe and consequently for Ihi, at least 1 legal entity should be established in a member state in order for the proposal to be eligible and go through the evaluation process. As previously mentioned, specific eligibility criterion for Ihi is the 45% in-kind contribution. This is applicable only for the single stage course, therefore not applicable for the first stage out of the 2-stage course. And why this? Is because in the 2-stage course, where we already identified the amount of the in-kind contributions with the industrial partners who drafted the topic text. Therefore, this 45% should be formed as in-kind contributions or additional activities or financial contributions. It is recommended, however, the consortiums apply for the single stage to target more than 45%. Personally, I would say even around 50%. Of course, this is not a point for the evaluations. It's not a requirement. The minimum requirement is 45%. Even though by reaching the 50% of in-kind contributions, this will mitigate any future risk, for example, any possible changes of the in-kind contributions that might happen during the grant preparation phase if your proposal is successful, and then you should maintain the 45%. Otherwise, we will not be able to sign the grant agreement. So by seeking more than 45%, you play safe during the future implementation of the projects. To stress this once again that if the 45% is not presented in the proposal, in the budget, the proposal will not be evaluated, therefore the proposal will be ineligible. And importantly, once again, this should come from the member associations. This is the only way that the 45% will be counted as part of the project cost. The eligibility for participation is one thing. However, who is eligible to get money? Who is eligible to get funding? And for the single stage core, I would say that everyone is eligible to get money from the public and the private sides, from non-profit organizations, from academics, hospitals, public bodies, NGOs, research organizations, regulators, and also the private sector, the for-profit legal entities, SMEs, and even larger companies. However, during the preparation of your proposal, you have to balance the ones who are actually seeking funding with the ones that bringing the in-kind contribution in order to ensure the 45%. From the industry associations, as far as we understand, will not request funding and will bring in-kind contributions in order to meet this requirement. However, by requesting funding, it means, and you're eligible for funding, it means that you're coming from, that you're a legal entity that's established in a member state and associate countries, or from low and middle income countries. The low and middle income countries, it's a new category that is created for Horizon Europe. So please, in order to see the full list of countries that are part of this category, please consult the Horizon Europe program guide. Regarding the eligibility rules for funding of two-stage call, once again, we have the non-profit organizations that are eligible for funding, the academic institutions, and here is the difference comparing the two-stage calls. The single and the two-stage call is for profit legal entities that have a turnover less than 500 million. This actually includes SMEs and mid-cap enterprises. Once again, this entity should be should be established in a member state, associate country, or low and middle income countries. Importantly, what is not eligible for funding, of course, are the pre-identified industry consortium. These are the partners who actually drafted the topic text and bringing the in-kind contribution, and any legal entity that is a for-profit legal entity with an annual turnover of equal to 500 million or more. So we're talking about the large companies. And even though you might have less than 500 million euro as an entity, but if you are controlled directly or indirectly by a profit legal entity with an annual turnover of 500 million or more, then will also not be eligible for funding. Our first call for proposals, the call 1, that includes the single stage topics, and the call 2, that includes the two-stage topics, published on the 28th of June. So these calls will run in parallel. Of course, the full topic text, along with all the relevant recordings and webinars, are available in IHI website. We have also webinar on how to build the budget, webinar on the rules and procedures, specific webinars on the topics, general webinar on the brokerage events. So you have a lot of information so that you can consult while preparing your proposal. Moving now to the single stage topics. Like we said, is a bottom-up approach, is much more flexible in terms of the application. The short proposals, as far as I remember, is 20 pages, and at the same time, it's up to the applicants to propose their approach or how to tackle the specific challenges of the topics. Of course, due to the time constraint, I will not be able to go in depth during the topics, even though I'm not an expert in the field. So it's actually up to you, up to the applicants, to convince the experts on how to address the specific challenges of the topic. We cannot provide interpretation of the topic text. We need to ensure the equal treatment of applicants. Therefore, it's up to you how to present your proposal by meeting all the requirements of the topic text and be successful. In a snapshot, the first topic is about the innovative decision support system for improved care pathways for patients with neurodegenerative diseases and comorbidities. The main challenge of this topic is that most of the patients with the neurodegenerative diseases have comorbid conditions that complicates actually the course of the disease from the diagnosis and management of care of the patients. Also, the medical specialties that are taking care of these patients are not really working together. There's a silos across this, and it's very crucial to consider the patient perspective and quality of life aspects. With this topic, we're looking the possibility to create solutions to translate what is essentially a heterogeneous and fragmented set of complex, measurable, and then analyzable data elements into clinical decision support system to better guide patients in the healthcare pathway. Applicants should propose a package of activities and its expected outcome to lead to a more reliable tools and methods. Real-time feedback on health interventions is essential, supported by sustainable digital platform and collaboration framework across specialties, so they can really collaborate together, and stakeholders, not for the current, but for the long-term benefits to patients and the health care systems. The second topic of the single stage call is about the next generation imaging and image-guided diagnosis and therapy of cancers. An optimized image-based care path from early diagnosis and screening to treatment and follow-up is essential to improve the outcome of cancer patients and also to help optimize the clinical workflow and the journey of the cancer patients. So next generation imaging technologies and image-guided solution as part of these combined cancer therapies will be of a high value. So the scope of this topic is to pull, link, and use existing cancer patient imaging and other data, so to develop artificial intelligence and machine learning-based algorithm, so to enhance of image guiding tools in clinical settings, so to assist and guide clinicians at the different steps of the cancer care. The applicants should work towards a more efficient patient-centric diagnosis, therapies, interventions with better outcome for patients, of course, simpler clinical workflows to reduce the workload on staff, significant reduction of therapy and intervention time for shorter recovery. The third topic of the single stage call is about the personalized oncology, innovative people-centered, multimodal therapies against cancer. Of course, the challenge here is that there are different treatment modalities are available for various cancers, but the differing biology of the cancers and the differing efficacy of treatment modalities show the need for patient-specific approaches. So there is a strong need to increase the therapeutic arsenal for such multimodal therapies and tailor the treatment approach to the individual patients. The scope of this topic is biomarker-guided, multimodal personalized oncology based on imaging, phenotype, genomics, in vitro diagnostics, comorbidities, clinical and real-world data, as well as the development of new health technologies integrated with the current therapy concepts for multimodal therapies personalized to the needs of individual patients. Applicants should build a platform of collaboration across the different sectors, develop standards and demonstration of how the benefits of health technology convergence can be harnessed to enable personalized cancer therapy and improve, of course, the multimodal therapy for better patients' outcomes. The fourth topic, and the final one of the single stage call, is the access and integration of heterogeneous health data for improved health care in disease areas of higher met public health needs, where witnesses a full range of data, not only, for example, clinical trial data, but also data made available, for example, from sensors, applications, etc., etc. And the challenge is to access, integrate, and analyze this data that actually could be a good use in the healthcare delivery and research to maximize the value for patient care and research The scope is to provide a scalable platform. Is not to reinvent the wheel. We already have available platforms that applicants could actually use. So to integrate or link of this diverse data and develop tools to allow the data to be used in clinical care, patient self-management research in disease areas of high unmet public health. Applicants should also ensure that in a long-term access to diverse data via the link and integration of the novel and cross-sectoral sources is not only when the project finishes that will not use all these platforms, but to ensure a long-term use, the development of tools and clinical support systems that facilitate the disease self-management, empower the joint healthcare professional, patient decision-making, and you can understand this is a patient-centric topic, help delivering better healthcare services. So here we're looking for tools to improve patients' lives, tools that are patients and healthcare professional focus. Regarding the two-stage topics, once again, I will go through as a snapshot, so we'll not go into details. The first one is out of the two topics is cardiovascular diseases, improved prediction, prevention, diagnosis, and monitoring. Cardiovascular diseases is one of the leading causes of death globally. It's a real problem and a real burden for the society. Of course, we have some good treatments, but there is a need for more personalized approach and cardiovascular risk assessment. The scope of this topic is to provide tools for early diagnosis of atherosclerosis and heart failure and identification of patients at risk. The expected outcome where applicants should provide the basis for better primary and secondary prevention of cardiovascular disease via the prediction models to improve stratification of patients and, of course, retrieve insights in order to achieve earlier intervention. Regarding the second topic of the two-stage call is setting a harmonized methodology to promote uptake of early feasibility studies for clinical and innovation excellence in the European Union. Of course, the main challenge that the development process of innovative health technologies in order to lead to the market uptake is quite lengthy. And the early feasibility studies could actually help and facilitate this process by capturing early relevant information and by optimizing design before actually running in the large clinical investigation. With this topic, we're looking to develop a methodological framework for early feasibility studies, of course, with compliance with the EU regulations, to be easily accessible via the online portal, information to be provided or how to undertake such studies, the process, the requirements to follow to fulfill, and the recommendations for best practices. It's important that a network should be created in order to promote the contact on early feasibility studies, and the use cases also to be used to inform and refine and validate the framework. Applicants should propose activities by creating a methodology, establishing methodology for the early feasibility studies to facilitate the compliance with the EU legislation and the creation of stakeholder network that will actually contribute and improve patients' access to health technologies and smoother the development process. Now moving to the timelines for this for the single stage course. Now we are in July. We're very close to the course submission deadline. We still have summer to go, and the deadline is on the 20th of September. So you still have time to prepare a successful proposal for IHI. Directly afterwards, we'll go to the scientific and evaluation in October, and by end November, we're targeting end November to inform applicants on the evaluation results and invite successful applicants to the grant agreement preparation phase. And we'll envisage that the grant agreement signature will take place by March 2023. For the two-stage call, it's quite a lengthy process because of the 2 rounds of evaluation. Once again, for both calls, call 1 and call 2, the call submission deadline is on the 20th of September, so please do not wait the last minute to submit your proposals. Try to do it a little bit in advance, because sometimes we might experience issues with the platforms, with the funding and test portals, so please don't wait the last minute. After the submission deadline, the call 1 and call 2 will run in parallel in October for the scientific evaluation and evaluation results by the end of November. The successful proposals, the top ranked proposal, will be invited to merge with the pre-identified industry consortium. They will prepare the full proposal, and the deadline will be by the end of February 2023. We'll have the evaluation in March and the outcome in April, and we're looking forward to sign the grant agreements with the successful consortium by July 2023. Now to sum up and put in a comparison, let's say, in order to make it more understandable to applicants, our 2 types of call for proposals, the single and the 2-stage. The single stage course will have a broader topic, so it's up to the applicants to propose their approach in order to meet the specific challenges of the topic. Of course, the private members can apply simultaneously, so we cover the entire consortium care in this single topic, and this is also part of the evaluation. So the consortium is mixed by public and private members. Due to its openness and competitive character, of course, private member can receive funding, can request funding, even though the consortium, at the consortium level, applicants should assure the 45%. Pharma companies ensure that they will abstain from requesting funding, FPA. Industry partners will build, like we said, consortium with the public partners. This is similar to the Horizon Europe. This is not a novelty for IHI. And of course, the 45%. For the 2-stage topics, the topics are actually the budget, like it was previously mentioned, is determined by the private members. They actually determine the in-kind contribution that they will put for the specific project. Applicant consortia requesting funding should be preparing the short proposal, the 20 pages. The successful applicants consortium will join with pre-identified industry consortium at the 2nd stage, so only 1 proposal. But in fact, no funding regarding the eligibility for larger enterprises of 500 and more million euro. And of course, the applicant consortia of the 1st stage will not be required to provide in-kind contribution. All of you can actually be part of the program from one or another way. You can be part and shape the future research, or if you want to get involved. Firstly, if you have expertise, if you're expert in the field, you can actually register and become an evaluator or independent observer. Here is the links that you can register, create your profile, and you can contact the IHI, showing your interest to be part of the future evaluations, or even be part of the interim reviews of the ongoing projects. Of course, you can be part of the patient pool. To join the patient pool, that will be also reopened later this year. You can propose new ideas that can be translated as a future topic. This is a specific process that will be available soon on how to handle these ideas coming from a different, from the wider, let's say, community. And you can actually contribute to a program level either by joining industry association, where your in-kind contribution can count against the 45%, or becoming a contributing partner. And of course, by applying and be part of this IHI project family. Before moving towards the end of this presentation, it's important, it's essential to mention that the data and the new technologies and digitalization is the focus of the new program. The cross-sectoral collaborations at the heart of this new program, and this is why IHI is created. Even though we're building on the experience from IMI1 and MIA2, our focus is to go beyond the medicines development and support the translation of scientific progress, technology advances, big data opportunities, and improve healthcare. Our course, our programs is also patient-centric. We need the patients to be involved, and we focus on the patient's journey, from the prevention to diagnosis, treatment, and management of diseases and conditions. IHI is here to actually support as a neutral platform the researchers, industries, different sectors, regulatory bodies, healthcare providers and healthcare professionals, patients, carers, so to work together and address all together the challenges in order to have more sustainable healthcare system. And please stay in touch, consult our website. You have a lot of information. In the specific call section, you will find all the information required to build your proposals. You have the proposal templates. You have the relevant annexes. We have also the guide for applicants, where you can see tailored examples of budget tables, so can help you to build your proposals. As previously mentioned, we have webinars for the applicants, topic-related webinar, but also rules and procedures, webinars on how to deal with all the financial aspects, the novelties of the new program. But in case you have more questions, you need more information, please do not hesitate to contact the IHI at infotex@ihi.europa.eu. And of course, you can sign for receiving our newsletter, follow up on Twitter and LinkedIn, where you can see all this beautiful journey that IHI is going through the next programming horizon, Europe. Thank you very much.
Thank you, Polybios. Excellent. Really, it was a marathon through many aspects. I think it was an excellent presentation highlighting the novelties of IHI in terms of governance, new board, the Bsip. It's a novelty. Thank you also for guiding us through the rules for participation, which have also some new aspect. And as you will see also from the questions, it seems that some concepts still probably seems not clear, not because you didn't explain it well, but I think it's really a matter of trying this new method while creating the consortium, the budget, etc. Thank you for clarifying that the strategic research agenda is our Bible. Thank you for clarifying the objectives that we are trying to achieve with this new IHI programming for the next years. So it's very important, as we said in the beginning, that the applicants, the researchers, the patient association, regulators are understanding also the different cut that IHI has compared to cluster one collaborative research. It's really different dynamics with a different synergic objective. So I think it will take a while before the community is really understanding how to be in synergy, how to really answer to the topics. So a big thank you to you and you, Liberty. I think we have a few minutes, like 5-7 minutes for questions before we go to the next speakers from Industrial Association. We can project, okay, all of them, but I think some of them were already answered while you were talking. But anyway, first thing, the availability of presentation, slide and recording, of course, you will receive both. I'm reading just the first ones again on the 45% of budget, the in-kind contribution. Here they say should come from the 5 industries, probably meaning the 5 industrial associations, which are partner of IHI. Però non le muovere. Sorry, the screen is moving. Or from private partner involved in the consortium. Do you want to answer to this?
Yes, actually, the 45% of budget should come from, of course, the industry associations that are part of the consortium. This is the first thing, but also it can come from contributing partners. It's not only the industry, but also contributing partners are expecting to bring additional funding in the project, and these 45%, of course, can have a form of in-kind contribution, additional activities, and financial contribution. Yes, it should be from private members involved in the consortium and possible contributing partners.
Thank you. Sorry, in the last second, your audio was a bit lower, but I suppose that your answer was clear. There is also a very general question on if each of the topic you showed, probably stage 1, double stage, is created by one single industrial association or more than one. This is more on the process. How does it happen?
Here there is not a distinction between the single or two stage. So for the single stage, as we said in the beginning, we have the SRIA, which is the Bible. All topics should actually be connected to the SRIA. We cannot really go beyond and create any other type of topics that are outside of the SRIA principles, let's say. So for the single stage, IHI is creating, is developing the topics as a pen holder, but we seek input from the wider research community and also from our founding members. For the two stage, it's developed by the industrial members who are actually willing to put in kind contribution. So in the topic text, if you go to the work program and you go to the specific topic text, you will see there the contributions and the partners that are part of the pre-identified industry consortium.
Thank you also for this clear answer. There is one question again.
Caterina,
I saw one on the hospital.
If it helps, I can reply also to the last one that I can see on the screen. For the two-stage calls, only 2 proposals will pass, meaning one for the one topic and another one for the other. So only 2 proposals, 1 per topic, will move to the second stage.
Okay. Can we scroll down on the screen to see the other questions? Slowly.
Okay. I will start, Katerina, very quickly from on the first one, ICOP, IK, NFC, in-kind contributions, in-kind contribution, additional activities, and financial contribution. Unfortunately, due to the time constraint, I cannot really go through the details. So I invite applicants to go and check an amazing presentation that we have on how to prepare your budget table, where everything is very well explained. You check the guide for applicants, you have the tailored examples, and please do not hesitate to contact us if you have further questions.
Yeah, it's very long explanation indeed.
Yes.
I've seen that there is a presentation on that with the clear example of budget building. Maybe this one again, private partners in stage 1 must be indicated by the consortium. Contact with members of the IHI partners should be established directly by the consortium.
Private partners. So here, do we refer to the single or two-stage course? For if it's for the in 2-stage, of course, like we said, it's a pre-identified industry consortium. Applicants that are willing to prepare application, the short proposals, shouldn't contact the pre-identified industry consortium. They should work towards building their application based on the information of the topic text, and also follow all the instructions included in the proposal template. So I would say contacting the members that are part of the pre-identified industry consortium should avoid it.
Thank you. I'm also reading on my mobile phone because it's even clearer. There is one question. Okay, again, general. For each call topic, do you expect a single big winner to be chosen, or there is the possibility that many smaller projects can share the budget of the call? Well,
for the single stage course, of course, this depending on the funding, available funding, and how much money applicants will request in order to implement the proposed activities. However, I suspect that we might have 2 proposals per topic to be funded.
Okay, thanks. And I also scrolled down to one who's saying, is it possible for an hospital to contribute to 45% fundings with staff personnel?
By the way, if Hugh Laverty would like also to intervene, please free. I know that you're sick, but your experience is also valuable to the implementation. Regarding this specific question, like we said,
screen?
Yes, maybe we can put up here on the screen. So once again, the principle is the membership. I can't see that the hospital could be part of the industry associations. So if it's not part of the industry association, is not an industrial member, will not count as 45. The contribution will not count against the 45%.
Yes, we have connected now, Mr. Laverty. I hope it's fine for you. Yeah.
Yes. So apologies to everybody, but I have a very bad cold, so my voice would not have coped with the long presentation that Polivia
Excuse
did,
us for disturbing.
No, but I just wanted to highlight a point to the previous question. And it is, you've got to remember, we are not just a normal funding mechanism, and we're not just doing small projects. The whole point of a public-private partnership is that we bring public and private partners together, and we should be looking to do things at scale. So we don't want to fund 20 small projects. We might fund 1 or 2 projects under a single stage call, but they should be at scale, both in terms of the participation of lots of different stakeholders, but also in terms of the amount of money that can be mobilized to tackle a challenge. So when you're thinking about a joint undertaking, you should always be thinking about, we exist to do things that you may not do in other parts of Horizon Europe.
Yeah, thanks for underlining this. But in general, I see that, okay, there is a question on the, is there any platform to find partners? Yes, there is. And yeah, probably you want to comment on the brokerage event you had in June and this platform, which is still open until, or it was open until, yeah, I give it to you.
So the platform, so we ran a brokerage event just before we launched the call, where we tried to facilitate bringing the different public and private members together. We had a little platform to facilitate the networking and the setting up of one-to-one meetings. And that platform is actually going to remain open until the 20th of September, until call closure. So if you are interested in trying to find other partners who might be involved, you can still go to that platform, and you're able to see the other entities that were involved in the brokerage event and who might be interested in forming consortia.
Now I would ask to you, because I see that there are some questions repeating on the 45%. So I don't know if you see any questions which is new.
I saw earlier on a question about artificial intelligence and topic
Okay,
2.
yeah.
And I know it's a very specific technical question. So what I would suggest is that whoever asked the question to please have a look at the topic text, because it's quite clearly laid out. I'm not an expert in the field, but I would suggest that what is described in the sentence is probably in scope. But if I look at the actual topic text, it says, the proposal should aim to improve artificial intelligence, machine learning enabled imaging, and image-guided solutions in order to assist and guide clinicians during diagnosis, staging, patient monitoring, therapy planning, intervention, and follow-up. Where appropriate, proposals should demonstrate novel ways to interact with the imaging data. So I'm afraid, based on a very short question, I would suggest that I think that what is proposed would be in scope, but to double check, please go to the topic text. It's very clearly set out what the impacts and the expected outcomes are. And if you still have any questions, I would then follow up, send a message to the office, and the scientific officer who is following that topic can come back to you and answer any more specific questions that you might have.
Thank you. I know you are very well organized, and actually the assistance that IHIJU is providing is excellent. Anything else on the screen you feel like answering?
The 45% is a really hot topic there.
Yeah.
And this is why we're a public-private partnership. If we haven't had the 45%, this could actually be implemented in other Horizon Europe programs, exactly what you mentioned before. And this is how we translate the PPP. It's a public and private. So we need the private investment in the topics and in the project afterwards. So it's a requirement to be.
Yes. And I think the questions keep coming back. The 45% in-kind contribution must come from members, so the industry members and or contributing partners, and they have to be part of your consortium when you apply to a single stage call. So we know this is challenging, but those are the rules that we have to apply.
And Hugh, maybe it's also once again to repeat, to advise actually applicants to seek more than 45%, because we experienced in the past, even through IMI2, that certain work plans are changing because this is not a stable environment. We might end up in a risk if certain activities will change, but of course, according to the objectives of the topic. So not to be the project at risk going below the 45%. So just to have this safety, let's say between the 45 and 50%, so applicants, future projects to be flexible in terms of any changes in their consortium, because the 45% will follow them also afterwards.
Yes, the 45% is a minimum threshold.
Exactly.
So of course, it's always good to build in a little bit of contingency, because you never know what's going to happen.
Okay, minimum threshold for 45%. Okay, thank you. Can I just make one just very final, not remark, actually a question? If you feel that in the topic from IHI, is there an indication of TRL, technology readiness level? Like
TRL,
yeah.
The technology readiness level is not really envisaged in this call 1 and call 2. However, it's not like we're not going to use the TRLs for the future calls. This will be depending on the topic definitions, the preparation, but it's there in case I will be used in the future.
Okay. I think just to remind everybody, an awful lot in IHI, like an IMI, we are trying to support projects in the pre-competitive space, and therefore TRLs don't often come into the types of projects that we do. However, I think this is a new program, and we are going to involve a lot more technology companies. So I agree with Pelevis. I wouldn't rule it out at this stage because we don't know what might develop, but we tend to focus on the more pre-competitive space. So it's not foreseen for these calls, but you never know.
Thank you also for this clarification. It's important because we generally also receive this type of question because maybe applicants are used to the cluster 4 digital tools, etc. So it's important to underline also this aspect. Then I think we can now end this question and answer session and thank the speakers from IHIJU very much, really, for joining in.
Caterina, if I could just make one little last remark before you finish up. If the people who have joined today have any questions, don't hesitate to contact us. If something is unclear, such as 45%, who is a member, who's not a member, please just drop us a line. It's our job. So we'll be very happy to answer whatever questions you have.
Okay, then thank you once again, and I think that the mail account are also in the slide we will share with all of the participants. So thank you. I hope you can stay a little longer. Yeah, you are with us a little longer. So now we change the stage again for inviting two speakers. Ms. Joanna Wills and Mr. Bernd Stovasser. They are also representing two industrial associations. So they are today representing also the vision of industrial association who have joined the JU. Joanna Wills, the research manager Northern Europe. Hello. From GE Healthcare. She's the co-chair of the Co-Chair Research and Innovation Panel. And then Bernd Stovasser, head of Sanofi Partnering Germany, global head of Sanofi Public-Private Partnership, a member of the FPR Research and Innovation Strategy Group, and chair of the Research Infrastructure Core Group. So this is the introduction to them both. I know that they have a presentation they want to share with us, so they will bring us through the industrial association governance, what they do, how they work. I will then give the floor first to Joanna, right? Or yes, please.
Bernd will start. Thanks very much for having us. Bernd, please. Oh, Bernd will begin.
Can you hear me?
Sì. Sì,
okay.
perfettamente.
Okay. Yeah, so first of all, it's of course a pleasure for Joanna and myself to join this Italian meeting. So actually, usually I have to use a virtual background, which does not work in this program. So you discover that in one corner you have Italian coffee, then the paintings are Franco Angeli and Alberto Abate. So you probably can guess where they come from. And I joined from the most northern city or affiliate of Italy, which is Munich. So I guess I have a few arguments to join this meeting. So yeah, so I'm sure that the IMI or the IHI office people have given you already a great overview on the mechanism of IHI and the relation, how it came from the Innovative Medicines Initiative, IMI. So actually, I was one of the first in 2008 to lead the project in IMI, which was in diabetes. And so I have quite some hands-on experience in this endeavor. So the new thing here really is, and that's why I think it's so exciting, that beyond the public partners, we have 5 industry associations or 3 plus their sub-associations going across different areas in the healthcare system. So it's the Medtech, the COSIR, the FPR, and this is really new. This has never been done before in such a dimension. So next slide, please. Yeah, this is just, we have included a few slides, which we will not go to in many detail, but it's for you as you get the material. So you have the websites, the links, and an idea who is part of this IHI endeavor from scratch beyond the European Commission. So this is FPR vaccines. Yeah, okay. So go ahead. Yeah, next slide. Go ahead. Yeah. So this is really a critical slide, and it was discussed just a few minutes ago, and a lot of questions came in. So it's really, the key message here is really that when you want to engage in an IHI consortium, you have to make sure that you bring at, and Joe Lafferty said it, you have to bring at least, because this is really not a nice thing to have. This is a minimal eligibility requirement. You have to have at least 45% of in-kind contribution coming either from the industry members or from contributing partners, which can be associations like the JDIF or Helmsley Trust. So there are many associations you could also look for where you can get in-kind contribution for the project. So overall, the budget is beyond the 2 billion euro. And again, it's important to highlight that only the part coming from the European Commission is cash for the applicant consortium. The other, which is the in-kind contribution from industry, is really a contribution from industry, not only to have half of the budget from industry and half coming from the European Commission. It is also to ensure the engagement of all parties, so that industry is not only paying money, but really going into the project as participants, as members, and being really a part of the project itself, to ensure that we have the best expertise from the public side and the best from the private side to make successful projects. So next, please. Yeah, this is just to show how the budget is overall split. Overall, the message is as on the previous slide. You have to make sure that you have in your projects the participants from the private side to get to at least 45% in-kind contribution. Next, please. Okay, so today our role is not to explain all the details of the mechanism, but rather to give you a view why we as industry partners are so much interested to be in this endeavor. So overall, the FPR, which is the European Federation of Pharmaceutical Industry and Associations, we represent basically the biopharmaceutical industry operating in Europe, but this also includes companies from other parts of the world, mainly from the US. So clearly, we want to contribute to a healthier future for Europe. And overall, the mission is to deliver, innovate, develop new therapies and vaccines for the European population. But of course, we are also an important factor to the economy. Next, please. So this is just a few facts on the size, how many member companies, etc. And you can also see here that we have SMEs as members. So you can look at those slides basically just for the numbers. Next, please. Yeah, this is also to show the member companies, and this is also just meant for help if you look for partners, and so you can look at the individual companies in case you want to enroll them in a consortium. So it's just a reference. Next, please. So same here, as I mentioned, the member companies include small, medium enterprises, not only the big pharma. Next, please. Yeah, so there are partners in research. This is actually an important factor. So if you have companies who are not part of COSIA or Medtech or FPR, they can register as partners in research. By this, their in-kind contribution can be part of those 45% you need to apply for a consortium or project in the application process. Yeah, then there is Vaccines Europe, which is a subgroup of the FPR organization, which is obviously, as the name said, focused on vaccines. Next, please. Yeah, so also the FPR member associations, and so in Italy it's a Farm Industria, are considered as FPR for the purpose of IHI. So if any company is a member of this association, the in-kind contribution is eligible in the application process. Next, please. So I mentioned the first call in IMI was really down in 2008. And also we have to prepare for our internal management and to the public to show what has been the outcome here. And at the beginning, after 1 or 2 years, questions came, what comes out of IMI, and is it worth the effort? And so, of course, if you have 5-year to 7-year projects, in many cases, you cannot ask for the key results after 1 or 2 years. But now, as IMI 1 is finished and the IMI 2, many projects have already finished, it's visible that you have an incredible success and outcome of those public-private partnerships. A lot of them are listed here. I don't need to go one by one as we have not the time to do this. Let me just mention one example where I was really part from the beginning, is the last point. In the Imedia project, we have really developed the first ever human beta cell line culture, which changed the way really to develop diabetic drugs. And it was a standard to really compare drugs and efficacy, which will be reflected in treatments for patients. So this is just one example. You can look at the IMI website and their incredible successes, which show you that it's really worth to engage in IHI. Next, please. So this is, again, a little bit the view, what is the way from IMI to IHI. And the overall budget in IMI was a little over 5 billion euro. So with IHI, we start with over 2 billion, but as you see on the left side, there was IMI 1 and IMI 2. So in future, who knows, maybe there will be an IHI 2. So what I'm saying here, the trend is increasing budget, really, and more and broader participation of key players with companies beyond FPR, with Medtech and COSIA. So this is really a very, very strong argument to engage in this partnership, also, of course, from the public side. So next, please. Yeah, this is a bit also the Eurobio Mission, which is aligned with the FPR. So it's a voice of biotechnology in Europe. Next, please. A snapshot of members, which also for your reference when you look at the slides later. Next. So I would now hand over to my highly valued colleague from COSIA, Joanna Wills, and I thank you for your attention.
Thank you very much. Indeed, I'm delighted to be here. Thank you for organizing the day, and thank you for having us. So as Bernd sort of described IMI and the history, and we've heard about IHI, and I think the most exciting thing is that this is now a mechanism where there's both pharmaceutical companies, but also medtech companies around the table that really spans the entire healthcare spectrum. And so the industry that's represented is via Medtech Europe, as well as COSIA. These are the medical device companies. I'll talk a little bit about those. So firstly, COSIA. So COSIA is an industry association for Europe that has been around for over 60 years. And that industry association is one that has many working groups to be able to support the industry for topics that are common to each other. There are working groups such as those for regulatory affairs, where you can discuss things that might be of impact to the other industry members. And there's a working group for the research and innovation focus group. And that's where I'm a member. And I represent GE Healthcare. But I'm able to speak with my European colleagues about things that are relevant to each other. More broadly, COSIA represents the imaging companies, so such as medical imaging, radiotherapy, electromedical technology. I tend to think of it as the big box medical technology. as Bernd described the FPA companies, here's an example of all of the, or some of the COSIR companies that you can see are members and will be able to take part in IHI. And similarly to FPA, if there are national trade associations across Europe and a company is a member of one of those national trade associations, they will be able to be represented by COSIR at IHI. And you can see those examples here, including the one for Italy. On to Medtech Europe. This is another Medtech industry association. And I think about it sometimes as the small box, Medtech companies. But these are medical devices. They can also be in vitro diagnostics or implantable devices, so a slightly different focus than on COSIR. But similarly, they represent industry. There are working groups where you can discuss things that are relevant to the different industry members. And a big one that's we've been working on is IHI. They're also based in Brussels. These are some of their working groups: external affairs, legal and compliance, market access, and as I say, research and innovation. But I guess one of the things I'm most excited about with IHI is it is absolutely unique around the world to have all of these healthcare stakeholders together. I've never seen anything like this. So it's the opportunity to collaborate with medical device companies. It's the opportunity to collaborate with pharmaceutical companies, but also with the national regulators, healthcare professionals, the member states. There's patients and citizen groups that are involved in this consortium. So really a worldwide unique opportunity to collaborate in this cross-sectorial manner. And I think it'll be really excellent. And there's lots of ways to get involved. So the IHI team described the calls that are coming up, but there's other ways. Here are the links. Please take a look. You can become an evaluator or an independent observer, and that's via the European Commission mechanism. So if you upload your profile, then you can be called on as it will be appropriate to evaluate the calls for proposals as they come up. There's an opportunity to get involved from a patient's perspective. That will be opened up later this year. Propose new ideas. We really want this to be a place where ideas can come from anywhere. We talked about some of the criteria. This is a joint undertaking, a public-private partnership where we need that industry side of it, but it's a partnership between the European Commission and please propose these ideas so that they can be considered by the working group. The other thing is to contribute at a program level. So we said there's an opportunity for contributing partners. So if you aren't already part of an industry association, there's still ways to get involved as a contributing partner. And you can see the link here. We've talked today about calls 1 and 2 that are open. The call 1 are those one-stage calls for proposals. 2 is the two-stage calls for proposals. They were launched in June. The submission is in September. So that's what everybody can do over the summer holidays. There's a link to those calls and how you can apply. And again, as the IHI team, there's lots of information about how to apply and the details of what needs to go into the application. And then we're expecting call 3 and 4. So again, that will be the one-stage and the two-stage calls that will be coming up at the end of 2022. There'll be draft releases of these topics. It will be done in consultation with the Science and Innovation Panel, the Governing Board, the European Commission, and industry, etc. So this will be call 3 and 4 towards the end of the year. So you can keep an eye out for that. Again, please take a look at the webinars. There's really great information online about how to put together a proposal, the financial aspects, the in-kind contributions, etc. And there are dedicated webinars for each of the call topics. You can get the link, you can get the presentation and a link to the presentation. Lastly, I think there were some questions about how to get involved and how to find partners. We're using, so the IHI has a dedicated website, but then there's also another website that's linked to the IHI website where you can create a profile. And there are brokerage events that have been held in the past. I'm sure that there will be more. You can create your own profile. And in this profile is where you describe who you are, what you bring to the consortium, and what you're interested in. Consider using keywords so that others can find you if they're searching for different types of partners. You can say if you've got in-kind contributions to give, or if you're eligible for funding, etc. And that's the mechanism where industry, academics will be able to form those partnerships, but also use your own network. That is absolutely allowed for the one stage calls for proposals, that you'll be able to get in touch with others to form a consortium and apply in that competitive process. Thank you very much for having us, and happy to answer any questions.
Thank you, Joanna, and thank you, Bernd. I was also checking the Slido, but it seems there were no specific questions to you for now, but I'm really grateful for being present, sharing with us the background, the work you've done in the associations. I think it's really exciting to see this wider, broader group of industrial association working towards a bigger impact. On Horizon Europe, we talk a lot about impact at different levels, scientific, societal, economic, and yeah, I'm sure that the JU will do really a great work. And I'm also happy to know that also Mr. Stovasser, Bernd, was a coordinator of one of the first wave of IMI project. So before leaving both of you and going to the final part and to the next speaker, Professor Pompilio, who is a member of the SRG for Italy, I think you have already met him or crossed him in these first months of activities. I wanted to ask if you have examples of how the past project of IMI have actually impacted even the healthcare sectors at a national level. What is your experience on the impact on the national healthcare systems? I don't know if my question is sounding you as weird, but yeah, thinking of impact. What was your experience in your project?
Yeah, so maybe I give the answer as I probably have the hands-on experience. So there is a long list of impact. As Hugh Lafferty mentioned at his presentation, we are mainly in the pre-competitive space. So that means we pave the way for faster and more efficient development of new therapies. In general, we don't create the new therapies in this program, except in areas where there is a high medical or societal need, like in the AMR field, or in indications where you have only very few patient populations. And by the way, in IHI, this will be the case for rare diseases. So the impact you find in a more indirect but very clear way. To give you one example, diabetes type 1 is a major burden mainly for young people. the incidence and the prevalence is increasing. So within IMI2, we have created the largest network of patient population for those diabetic type 1 patients to be able to have an early detection of the disease. And currently we run programs even to be able to delay or prevent the disease. So this is one of the clear impacts you will see on all European or national or global levels.
Thank you. Thank you. Joanna, a final comment or?
I think that because the medtech industry is joining the IHI for the first time in this kind of in this kind of mechanism, we're still learning. So we've got experience from Horizon Europe and from national grants, but those seem to be focused research opportunities where you're really looking at just one point, and there's always efforts to reach out and to disseminate, etc. But I think we don't have examples. But if anything, this is the place where it will be possible because we've got all of the stakeholders around the table and really thinking about, okay, what does it take to bring this, and we've got the researchers, but industry, what does it take to develop it? What does it take to bring it to market? And how will it roll out? I think if it's going to happen anywhere in the world, this mechanism is going to be the place where we'll see it.
Thanks. And I was thinking also of the slide you show on the third and fourth call. Of course, we don't know, or we don't know the content. Probably you are, of course, working on it already. But will there be an alternance of topics coming from the different associations? Do you know already if call 3 and 4 will cover a specific area, or this is totally unknown at the moment?
Still in discussion. So it's a brainstorming session where the European Commission is sharing unmet needs and alignment with the other programs, and industry are sharing trends that they're seeing. As I mentioned, there's the platforms to bring in proposals from the website or from the Science and Innovation panel. So ideas are coming from everywhere. As it was described, the IHI office will hold the pen and consolidate into what the calls, and I believe there will be draft releases of the call topics so that there can be comments on these, and before it's finalized and published. I think one of the other things we're seeing is if topics come up time and time again, is there a place for those to be programs in themselves, and then they change, so therapeutics or something, and then it changes the disease area on an ongoing basis, or does it move according to the the health needs and the trends at the time? Again, that hasn't been decided. So we've had the first calls for proposals come out in June. The second is expected in December, but there's 6.5 more years of this to come, and for us to look back, make sure we're achieving those goals, etc. So still an evolution.
Yeah, that is totally aligned with obviously how I look at it and how things are. So I'm usually famous for telling more in those meetings than I'm supposed to. So I will not make an exception today. And so there are currently clusters of themes being discussed where the topics really come from industry, from the public side, from the European Commission. And it will clusters which are there are around the 3 Rs. It will have to do also with HERA implementation, with preparedness and infectious diseases. It's furthermore biomarkers and personalized medicine, rare disease, green chemistry, and we focus a lot on clinical trials, remote interventions, and also for radiology and imaging. And this is what Joanna said, it's under discussion, it's abroad, and more calls will come. So, but this is really something where at least you have an idea on the clusters, and usually through your state representative member, you are very close to what's going on really firsthand. And I encourage you really to organize on country level meetings to discuss with your key scientists. So this is something where I have great experience in Germany. It is really important for us to be as transparent as possible. So nobody should have the impression that things are going beyond what the public can see. So that's why we are fully transparent, of course, and this was Joanna's point at the beginning. We can, of course, not communicate potential topics which at the end will not materialize.
Thank you, Bernd, for adding more and to keep the tradition of you telling always something off microphones. Yeah, I think it's important to show to the community also in Italy that there is an open process, that there is a call for ideas at member state level, and that there is a governance and there is a process to participate. So yeah, your final words are really linking me to the last part of this workshop on the first call, which are bringing me to introducing also our member state representative, who is Professor Giulio Pompilio, Scientific Director of Monzino Cardiological Institute. I see him on the screen. And I want to thank him, and just excuse me for this slight delay due to, always the 10 minutes of more questions. We were actually discussing with the two members of the associations how important is the call for ideas and the consultation at national level. Now I will switch again to Italian, excusing the four speakers we had before. Vorrei dare il benvenuto al professor Pompilio. Abbiamo parlato a lungo con i relatori della mattina di quanto sia importante anche il processo, diciamo, di stimolo a livello di member states, di stati membri, nel proporre idee alla JU, al Joint Undertaking, sulle aree di ricerca che poi saranno messe a bando nei prossimi 6 anni. Ci hanno dato qualche anticipazione sulle call 3 e 4 e Bernd ci invitava anche a organizzare a livello nazionale delle riunioni di ingaggio, insomma, con i maggiori, insomma, ricercatori di vari settori. Quindi noi ho già insomma accolto questo suggerimento, vedremo insomma cosa possiamo fare insieme col professor Pompilio. Io adesso insomma gli chiedo di raccontare effettivamente qual è il ruolo che lui ha intrapreso proprio in questi ultimi 6 mesi, perché è una nomina che parte con la nuova partnership, e quindi cosa ha potuto vedere, fare insieme ai colleghi europei in seno a questo State Representative Group, che è appunto un organo consultivo di advisory che la JU ha creato per poter legarsi anche alle necessità dei vari stati membri. Prego, le passo la parola. So che ha delle diapositive, se ancora vuole proiettarle.
Buongiorno,
prego.
Mi sente?
Sì, tutto ok.
Tutto bene, grazie dell'invito. Intanto sarò breve con la mia presentazione. Ho delle diapositive e penso che la regia le stia mandando in onda. Se per favore si può partire dalla prima, sarei grato.
Un attimo, mi sembra che non le riesce a caricare lei?
Sì,
deve solo metterle in modalità presentazione, le vediamo ma sono solo, diciamo, non ancora full screen. Cliccando lì in basso a destra, sì, perfetto, sul pieno schermo.
Le vede adesso?
Sì, però è solo che se riesce a mettere sul pieno schermo lì a destra.
Ho messo pieno schermo.
Va bene, le mettiamo noi, guardi, dico alla regia un secondo, mi perdoni. Pronte, può andare.
Ok, quindi niente, dicevo grazie per l'invito, sarò breve, quello che ho inteso fare oggi è di completare il ragionamento sul funzionamento di IHI, che è già stato in parte già spiegato dai rappresentanti delle associazioni dell'industria che mi hanno preceduto. Questa diapositiva in qualche modo ne riassume tutto il governing board, quindi l'IHI, come si è capito, è rappresentato per quanto riguarda l'Europa dalla Commissione europea e poi dalle associazioni dell'industria europee, COCIR, Europabio, FPA, incluso Vaccini Europe e Medtech, che ha raggiunto l'iniziativa IHI non essendo stata coinvolta in precedenza con IMI. Quindi, a parte queste entità, il Governing Board di IHI è, come vedete, un processo abbastanza complesso che coinvolge due gruppi, due entità che sono lo State Representative Group, di cui io faccio parte, e il Science and Innovation Panel, di cui parleremo brevemente adesso. Ovviamente tutto ruota intorno al direttore esecutivo di IHI e insieme al direttore esecutivo l'office che lo supporta. Allora, qual è il ruolo dello State Representative Group e dello Science Innovation Panel? Perché la mia presenza qui oggi e il rapporto di collaborazione che si sta creando con APRE, che appunto è probabilmente, che come vedremo fa parte della missione di SRG. SRG, lo State Representative Group, non è altro che un panel di rappresentanti, di delegati degli Stati membri europei e dei paesi associati a Horizon Europe. Il perché è stato statuito è per essere consultato per una serie di topic, ma la funzione più importante è probabilmente quella di creare un link attivo e operativo tra IHI e i programmi e le iniziative nazionali e regionali in materia di ricerca e innovazione. Ed è quello che anche con APRE stiamo cercando di fare. Per vedere quali sono i delegati dei vari Stati membri, si può accedere direttamente al sito dell'IHI e c'è la lista per l'Italia. Oltre al sottoscritto c'è anche la dottoressa Barbara Bartolini, che è operativa presso il Ministero della Salute. Io sono il delegato e la dottoressa Bartolini è l'alternate. Oltre a questo ruolo di link, diciamo, di connessione con le realtà nazionali in materia di ricerca e innovazione, il State Representative Group è stato istituito anche per una serie di attività di consulenza a cui può essere chiamato, che includono il drafting dei working programs e le call. Per esempio l'SGRG è stato ed è interpellato per le call che verranno, come la dottoressa ha menzionato prima, in particolare la terza e la quarta. Il SRG funge anche come link a Horizon Europe e altre iniziative europee in materia di ricerca e innovazione e anche, ed è questo un ruolo molto importante, un possibile link tra le organizzazioni industriali all'interno di IHI, non soltanto quelle, diciamo, di grosse dimensioni, ma soprattutto per quello che riguarda le small e medium size enterprise, le SMEs, le start-up e coloro che si affacciano a questo mondo da newcomer. Tra le altre ruoli dell'SRG ci sono anche possibili azioni di disseminazione dei risultati di Ihi quando verranno e un update dell'agenda strategica. E finalmente, come ultimo, SRG, soprattutto sotto la spinta di iniziative a livello nazionale, quindi perché ogni delegato ovviamente rappresenta lo Stato membro, può interrogare il direttore esecutivo o il governing board di Ihi su particolari questioni di natura tecnica, manageriale, finanziaria che risultassero essere poco chiare o da meglio, diciamo così, far penetrare a livello della realtà nazionale. L'altro board importante di cui vi parlavo prima è il Science and Innovation Panel. Perché è stato pensato il SIP? Il SIP è stato pensato come un board che raccoglie dal punto di vista dell'input scientifico la varietà degli stakeholder che avete visto essere all'interno dell'iniziativa Ihi, quindi deve veicolare input scientifici e tecnologici rilevanti all'iniziativa e l'input di altri stakeholder del sistema healthcare in generale per assicurare che i work program coprano attività e strategia che siano utili a trasformare i finanziamenti e i progetti che vengono finanziati all'interno di Ihi ai pazienti. Quindi il ruolo del SIP è quello di provvedere a una consultazione science-based al governing board di Ihi su questioni di natura scientifica o tecnologica. Quindi ovviamente partecipare al drafting dei work program e delle call che verranno, ovviamente aggiornare l'agenda strategica, il planning di eventuali attività addizionali, ha la possibilità di richiamare dei gruppi, degli advisory group ad hoc che sono ritenuti essere importanti per prioriterizzare degli item scientifici e l'altro ruolo è quello di operare in sinergia in analogia con l'SRG, con Horizon Europe e altri programmi europei. La composizione del SIP, che peraltro è stata finalizzata abbastanza di recente, vede la presenza di 2 membri della Commissione europea, 4 membri dei partner industriali dell'iniziativa Ihi, 2 membri del SRG, dello State Representative Group, che sono stati nominati, che sono il chair e il vice chair dell'SRG, e 4 membri della comunità scientifica, tra i quali viene nominato il chair del SIP, e finalmente 6 membri degli stakeholder che sono rappresentativi della realtà healthcare europea, per cui associazione di pazienti, professionisti, attività regolatorie, health technology assessment, eccetera. Questi sono i membri del SIP che sono stati nominati, come dicevo, abbastanza di recente, che provengono dalla comunità scientifica, dagli stakeholder, dai founding member e dal SRG. Li potete anche questi trovare sulla website di Ihi. E questo è tutto, questi sono i miei riferimenti, come ricordo sono il delegato italiano a Ihi, insieme alla dottoressa Bartolini. Quello che dicevamo prima con la dottoressa Monocore è che si potrebbe, sarà importante in futuro mantenere una connessione tra la realtà nazionale a vari livelli, scientifica, industriale, e IHI per quanto riguarda sia le call che sono in corso, ma soprattutto per la costruzione delle prossime. E con questo vi ringrazio.
Grazie professor Pompilio. Sì, abbiamo cominciato a lavorare insieme a inizio anno e effettivamente stiamo entrando nel vivo di questo nuovo processo, di questa nuova estesa joint undertaking. Questo è il primo evento in realtà di livello nazionale che organizziamo. Sicuramente per i prossimi anni ci organizzeremo in maniera magari differente, con workshop più piccoli. Speriamo di poter organizzare anche prima o poi delle attività dal vivo, sempre per incentivare questa liaison, come si diceva all'inizio, tra ricerca clinica, accademica, pazienti e industria, perché come abbiamo ascoltato più volte oggi, effettivamente entrare in gara all'interno della IHI e in questo tipo di progetti richiede veramente un contatto, una crescita proprio in parallelo tra della ricerca, tra quella diciamo clinica, quella accademica e quella delle industrie. Industrie di vario tipo, abbiamo detto che sono benvenute nel programma non solo ovviamente le grandi che fanno da pilota, ma anche le industrie le più piccole e medie, le start-up, eccetera. Quindi sicuramente noi possiamo dire che cercheremo anche a livello nazionale di incentivare e facilitare questo contatto per le call future. Ora sulla call 1 e 2 siamo in ballo, insomma, chi probabilmente vuole partecipare sta già lavorando. Per le prossime call 3 e 4 sicuramente cercheremo di organizzare delle attività preparatorie. Professore, io la ringrazio. Siamo, diciamo, credo ancora tutti collegati, tranne forse i colleghi dei saluti istituzionali. Vediamo, chiedo alla regia magari di dare un occhio a se il dottor Stovasser e la dottoressa Wilson ancora con noi, così come Hugh Polivios della HIJU. Se ci sono, magari facciamo solo un'ultima riunione a schermo, ma davvero per salutare il pubblico italiano. I will switch to English again, but I was just a bit gathering the messages you gave during this workshop for the Italian audience. We need to work better for the future to increase also the Italian participation to the JU, to the partnership, to the public-private partnership. We know that there are some criticalities. We are very well aware at ministerial level. APRE is also organizing activities in order to liaise better public and private links. We want to thank this very international panel. As you see, we really wanted to give this international flavor, so half and half, Italian speaker, international. We trust that we will all help each other in this process. No boundaries, no national boundaries, but just international objectives and high objectives. So what to say? Thank you. Sorry again for bothering international speaker on a holiday day. Have a good summer. I know we will all work a few weeks more, so before the break. We will circulate presentation. The session has been recorded, so you can still go through the presentation and re-listen to the instructions that we received today. And yes, just a big thank you once again, and goodbye to all of the audience and to the speakers.
Thank you.
Pleased to meet you, even if virtually.
Thank you very much. Happy holidays. Bye-bye.
Bye-bye. Thank you.
Ciao.